Hi, salam sejahtera. Good day. Ni hao, vanakkam, konnichiwa, and annyeonghaseyo. So I'm Dr. Choi, and today I have designed and created another schematic diagram on the topic of the arterial supply of the heart. So I feel that this is a very important topic because it has a lot of the clinical significance. So what you can see in this screen here is the outline of the external structure of the heart. So this is the right side of the heart and this is the left side of the heart. So this is the mirror image. Yeah. So along the way, I'll use some dotted line like this. Okay. So dotted line like this means the structure which is located at the posterior side of the heart. Okay, so here you can see the chambers of the heart. Okay, so here this is the right atrium, right ventricle, and this is the left ventricle. Okay, on the external side. So next one, what you can see here is the groove of the heart. Okay, so here is between the atrium and the ventricle on the right side. So this is right anterior atrioventricular groove. Okay, turning to the posterior side, so this is the right posterior atrioventricular groove. Now coming to the left side, this is the left anterior atrioventricular groove, and turning to the posterior side, so this is the left posterior atrioventricular groove. Now can you see this line here? Okay, this one is in between ventricle, so this is the interventricular groove. Okay, interventricular groove. So this one is the anterior and the posterior interventricular groove. Okay, so now back to the topic of today, arterial supply of the heart. So what supply of the heart is none other than the right and also the left coronary artery, which originate from the aortic sinus of the ascending aorta. Now let's focus on the right coronary artery. Okay, so first of all, we would like to talk about the cause of the right coronary artery. So this right coronary artery, okay, as demarcated by the right line here, this is right coronary artery, caused along the right anterior, the right anterior atrioventricular groove. Okay, as it cause, it will wind around the right margin of the heart here. Okay, and it continue posteriorly at the right posterior atrioventricular groove here. Okay, so this is the cause of the right coronary artery. The next thing to talk about is the branches of the RCA. So it gives off 5 branches. The first one is the sinoatrial branches, which is quite near to the origin of the RCA. The second one is the right atrial branch, okay, near to the right atrium. The third branches is the right marginal branch. Right marginal branch, like the name indicates, okay, it is located at the inferior margin of the heart. And the next one is the posterior interventricular branch. Okay, as the RCA course posteriorly, it gives off branches at the posterior side. Posterior interventricular branch, the names they also tell you, is located at the posterior interventricular groove. Okay, so next another one more final branch. Okay, this one, the atrial, the AV nodal branch. Okay, now let us focus back to the LCA, okay, left coronary artery. So now let us talk about the cause of the LCA. So the LCA, okay, like this, okay, as demarcated by the purple line. So this cause along the left anterior atrioventricular groove. Okay, so it's a very short course. After that, it terminates by dividing into 2 more branches. So the first terminal branch is what we call as the anterior interventricular branch. Okay, anterior interventricular branch. It descends down. After that, it will further cross to the posteriorly. So therefore, this anterior interventricular branch is located at the anterior interventricular groove. Okay, and also the posterior interventricular groove. Next one, okay, this anterior interventricular branch, okay, is also give off to one more branch, and this branch is called as the diagonal branch. Now let us focus into the second terminal branch of the LCA, okay, it's called as the circumflex branch. So this circumflex branch, okay, it follows the course along the left anterior atrioventricular groove, okay, and after that it will it will cause posteriorly again, okay, and it goes around the left margin of the heart, go to the posterior side, and it go to the posterior part of the left atrioventricular groove. Okay, it's go to the posterior part of the left atrioventricular groove. Okay, so it go around like this. So after that, it give off a few branch. Okay, so it give one branch to the left marginal branch. Okay, like the name indicates. Okay, it's located at the left border of the heart, and there's another one more branch called the SA nodal branch. So these are the cause and the branches. So another one more important aspect to discuss is the area supplied by all these branches. Okay, so now let us focus first on the RCA. Okay, so RCA, the sinonodal branch. Okay, so this is very straightforward. The names tells you what is the area or what the structures it supplies. So it actually supplies to SA nodal. Same goes to the right atrial branch. Okay, based on the location in the name, you know where it supplies. Okay, it supplies the right atrium. Okay, can you guess this right marginal branch? Where does it supply? Okay, it go around this area here. So it supplies the right ventricle. Okay, so how about this one? Posterior interventricular branch. Okay, so which located at the posterior interventricular groove. Okay, so it supplies both sides. Okay, so it gives supplies to the right and left interventricular, right and left ventricle, and also the posterior interventricular septum. Okay, and the next one is the AV nodal branch. Okay, the names is straightforward as well. This is clearly that it supplies the AV node. Okay, now coming to the LCA. Okay, the first terminal branch here, anterior interventricular branch and diagonal branch. Okay, so here is located here. So it supplies to both right and also the left ventricle and also the anterior two-thirds of the interventricular septum. Okay, so this circumflex branches is also, you see, it crosses along here. Okay, so it supplies, it's very near to the left atrium and the ventricle, so therefore it supplies to the left atrium and also the ventricle. Okay, so this left marginal branch, okay, so left marginal branch here, okay, is located at the left ventricle here, so it supplies the left ventricle. Okay, and the next one, SA nodal branch, it supplies the SA nodal. Okay, so another important aspect is the anastomosis formed by a few arteries. Okay, so anastomosis I will demarcate as the yellow ring here. Okay, so there's a few places where it forms anastomosis. The first one is here. Okay, so this anastomosis is formed between two arteries. Okay, let us trace back the red one. So this is formed by the right coronary artery. Okay, and another purple one here. So this is the circumflex branch. Okay, circumflex branch of the LCA. Okay, so right RCA and the circumflex branch forms a anastomosis. Okay, the next one is here. Okay, the next one is here. So it forms an anastomosis between these arteries. So what artery is this? This is the posterior interventricular branch. Together with this. Okay, so where is this? What artery is this? So this is the anterior interventricular branch. So anterior interventricular branch and the posterior interventricular branch form an anastomosis at the interventricular groove. Alright, so that's all from me. So what we have covered from here, so we have covered the cause, okay, we have covered the branches, area supply, and the anastomosis. So with that, thank you very much. I hope that this is helpful for you to further understand the arterial supply of the heart. So thank you very much and have a nice day.